about us. Think about you.
Hello, hello. How is everybody? Can everybody hear me okay? We're still, my camera's a little off, so I apologize, Roel. What's going on, Rhonda? How we doing? How we doing, everybody? Let's see if we are live on Instagram. We're about to go live. And we are live there as well. Thank you guys for hanging out over on the Instagrams. I'm seeing notifications that I am live everywhere. All right. All right. How is everybody? Thank you to Stan. Thank you. Thank you. Thank you. Do I look okay? We're still in a little bit of a we can't figure this out with our cameras. Tom, I love you, brother. I love you so much, man. You're doing so well. Thank you so much. Yeah, Apex is incredible. Apex is incredible. Who do we got? Who's in? We've got a full show tonight. I see Steve's in the building. I see you, Steve. What's going on, man? Great to see you as always. Loved getting to catch up this week. We got, let's see, I think Doc is on his way. Ron, what's going on? I see you on Instagram. Katie, what's up? Great to see you. Thank you for being here as always. We had a wonderful show go out on the Common Sense MD this week. Came out today. That is Marcos Garza over there. You've, if you're from the Knoxville area or the Johnson City area, you've most certainly seen the name. He's a great friend, an amazing attorney, talking about living wills, talking about advanced medical directives, power of attorneys. Super, super important episode, and one that, topic no one, loves to talk about, but we've been really interested in patient rights, and we've kind of been going with that theme, and Marcos did an incredible job of, kind of giving the legal side of things, and Doc did a great job of kind of combining healthcare. So super cool episode. I hope you guys get to check it out. Maybe watch it with the family. It would be super, super beneficial, and kind of talks about how to have these conversations that sometimes aren't very comfortable. I see Grandma Mary, I love you. Ivy, what's up? Ivy with Ivy's and Ivy and JC. Carter, what's going on? Happy Tuesday to you. Or happy Monday. Happy Monday and Tuesday. They're blending in. Rachel, what's going on? You had a beautiful pic on your Instagram today over there in the Johnson City office. I appreciated that. Wonderful fall day in East Tennessee. Anybody get outside? That's awesome. That's awesome, Tom. Man, that's inspiring to me. Thank you. We had a great episode on Explain This. The star of the show, Robin Riddle, talks about lowering androgens in PCOS. We get a lot of PCOS questions on the show and in office. So this was one about the impact that androgens have on PCOS and how to help with that. Robin gives us a few strategies. Thank you, Robin, for doing that episode. And then nutrition coach Lucas Schmidt talks about ginger. I don't know about you guys, but I was thinking he was going to tell me like how great ginger ale was for me, because that's my go-to. But ginger ale, has some extra stuff in there. But definitely check those out. Patricia from Michigan, I see you. Thank you so much for being here. Edna, I see you. Great crowd tonight. We're excited. See Doc is almost ready to go. Doc, ready? Almost. All right, here we go. Almost. We got a lot of great questions that came in throughout the week. If you got a question for Dr. Rogers, go ahead and put it in the comments. Ryan, I see you. D. Allison, what's up? Love you guys. Thank y'all for hanging out over on the Instagram. All right, is Doc ready? Cool. What's up, man?
How are you?
Yeah.
I am wonderful. You're looking dapper today in your performance medicine swag.
Yeah, you get a haircut?
No.
I can't tell with a hat on.
That's why I've got the hat on.
You have to vote. Who wants Ben to get a haircut? Who wants him to leave it long, grow it longer?
I got to get a haircut, man. It is, it's getting a bit much, and I have to wear hats to manage it. So that will be coming soon. I see Wayne's got a great question there. Thank you, Wayne. I see Jasmine's in here, our esthetician in West Knoxville. What's going on, Jasmine? Esty Bestie Jazz over on Instagram. Doc, you about ready to roll?
Yes.
Jasmine likes long hair. There we go.
Oh, good. Okay. Yeah. I
Uh,
like it.
all right, let's rock on. Let's get to some questions. You ready? Was your day okay?
Had a great day. Yeah. Wonderful day.
I'm going to put this up from Edna because this makes me happy. That's awesome. Seeing results from the PRP. That's awesome.
Oh, wonderful.
Thank you, Edna. That is one of those things, Doc, you were talking a few weeks ago, when you get a PRP injection, it takes a little while to start seeing results. So you got to be patient.
You have to be patient. It takes time, but it works.
Thank you, Edna, for keeping us posted. Keep us posted with how your progress is. You ready for some questions?
Yeah. Sure.
All right, let's do this. All right, this came in over email. Thank you in advance to all the email friends. Have you considered investing in an hyperbaric oxygen therapy chamber, for your patients?
Yeah, I have. I've looked at a few. Really, the ones, if I was to get one, I'd get a hard shell that delivered the PSI, the pressure that you need. They're very expensive. Then you have to have an employee to be there the whole time. You have to have a special room for it. So it's quite expensive. It's more of an economical thing, the reason I haven't. But yeah, it's always a consideration. To be effective, you have to get a lot of them too. You can't just go in there once a week and get them. You need to spend an hour at a time daily for 30 days if you're treating certain conditions like cancer and things like that. But yeah, I like hyperbaric oxygen. It's no doubt it's a great thing, but it's more of a financial thing too. But I like them.
I forgot. I want to give a one because I talked to him today. I talked to Mike Vickers from Biostack. Do they have a hyperbaric?
No,
they don't.
I don't think they have one yet. He's considered. We've talked about it together, but yeah, he's got about everything else. That's for sure.
Yeah, it's a great question there. Thank you for sending that in. I'm going to let's go to this one right here. If I decide to start intermittent fasting and skip breakfast, should I also skip my morning vitamin supplements that suggest taking with food until lunch as well?
Yes.
It goes on to say, should I take any vitamins during the morning if I'm skipping breakfast?
That's a great question. I switched when I went intermittent fasting a couple of years ago. I couldn't take my vitamins in the morning because you don't want to take most vitamins on an empty stomach. It'll upset your stomach. A lot of them are fat absorbable, but if you could definitely take your B vitamins, you could take C, any of the water soluble vitamins you could take. But what I do, I just split mine up really between lunch, dinner, and then I take my nighttime magnesium and the longevity formula. I have a pretty good list. I think I wrote my list out and when I take them in last week's podcast. So, but yeah, you certainly can. I would hold off. Spread your vitamins out.
I'm in the habit now of taking mine at night. I made the mistake of taking the super with One Immune on an empty stomach, and man, didn't feel so great.
That super is potent. It's really the real deal. Do not take it on an empty stomach.
All right, great question there. Thank you for sending that in. We got a couple of thyroid questions coming up, so those interested in thyroid, keep your ears open. This one came in through email. In May of 2024, my total T4 was 8.0. Free T3 total was 3.5. And then on my latest labs on September 30th, my free T4 was 0.99 and free T3 was 3.7.
Yeah, I see.
I am on 45 milligrams of MP thyroid. Is the fact that the T4 is increasing a concern? If so, what should I do?
Not really. It looked like it was decreasing. Wasn't your T4 decreasing? First it was your T4 was 8 in May of 2004,
And
and
maybe
then the
that's
T4 was
supposed to be
0.99, so it went down, and your free T3 stayed the same. Well, the money's in the free T3. And again, you go by symptoms. Certainly, if you're certainly not high at 0.99, you were at 8, but really a lot of this depends on, number one, how you feel, and I don't really look as much at the free T as a free T3, but the other thing you got to realize is it may be timing of when you took your pill in relation to when you got your blood test. What I recommend is always get your blood test at the same time. It's like if you get it at 9 o'clock in the morning, one time when you get it, 6 months later, get it at 9 o'clock the next time. And don't take your medicine the day you come. Let it be from the previous day. And do the same thing every time, because it's going to move around a little bit if you don't do that. And again, if you're doing great, your weight's good, you're not tired, your body temperature is normal. Sometimes I just go freely by body temperature, and don't even look at the labs as much. I like the labs because they're numbers and we like to look at them. But I don't know what your TSH is doing. I look at that one too. But the main thing is the free T3 and how you're feeling. Great question.
So if the T4 was in fact increasing, if it's not increasing a bunch, you're looking at a lot of other things, is what I'm hearing.
Yeah, I'm looking at symptoms for one thing.
Okay.
Yeah, I don't freak out about that at all.
If we need any context, let me know, and if that helps around the thyroid, if you have follow-up questions, don't hesitate to ask, because we like talking about thyroid.
You definitely don't want to overdo the thyroid when you start getting anxiety, tachycardia, weight loss. You're getting too much. Follow your body temperature as well. But great question. And a lot of times you will get different numbers based on what time you draw it, what time you took your last pill, and maybe even lab differences. If you get it drawn at a LabCorp versus a Quest, it may turn out different. So I hope that answered your question.
All right. I'm going to read a little bit from an email that came through, then I'll get into the questions just for context, Doc. I'm going to pull this up real quick. Question for Dr. Rogers is, I was recently diagnosed with papillary thyroid carcinoma. The cancer is in the left lobe of the thyroid. I met with a surgeon today, and he recommended we remove the left lobe only to allow the right lobe to still function. After thinking what he said, I have several questions. To preface, I also have Hashimoto's, which I've maintained well. Most recent thyroglobulin levels were 16, I believe. This was down from being in the 600s years ago. The questions are, let's see here. So there's the context. First question is, if I leave the right lobe, which appears to have no nodule shown via ultrasound, would I need medication to keep my thyroid levels where they need to be, or would the right lobe provide enough alone?
Yeah, that's a good question. First of all, you have the best kind of cancer you could have, which is papillary cancer of the thyroid. It's 99+% curable. So, you're going to get a cure. Now, you do have some options, of course. And again, your options are going to depend on which doctor you talk to. I've seen a lot of thyroid surgeries. My dad and my brother both, really kind of specialized in thyroid surgery, and I watched them do it many times. Most surgeons would tell you to take the whole thing out. Certainly, if you have an option though to leave it, because you still will have thyroid function. It won't be as much as you had before, so you're probably going to have to go up on your thyroid medication. But again, that's not a problem. Your Hashimoto's is a minor player in this. You can be controlled regardless, whether you have half of it or whether you have the whole one. it's pretty easy in the hands of somebody who knows what they're doing to, uh, meet your thyroid needs through the medication. Um, so you have to ask yourself, do I just want to get it out and be done with it? Which is certainly a pretty good option. There's other treatments as well, like
This is
radioactive,
context.
like radioactive iodine. But yeah, if you do get that right lobe out and leave the left, you're probably going to have just follow the thyroid uh, test and see where you are and adjust from there. But probably because you have less of a thyroid. If you get your whole thyroid out, you're going to have probably a little bit more. But I mean, your thyroid through your Hashimoto's may be well controlled, but you still have a thyroid disease that could, wipe out part of your remainder of your thyroid. So, the question is, should I just go ahead and get the whole thing out and just use medications to take care of it? You have to consider, will I get thyroid cancer in my other lobe, even though it's not there now? It's possible, rare, but possible. It's probably higher than a person that doesn't have it. Sometimes what they do is they go in and take your thyroid out. If they take your whole thyroid out, then they'll follow it up with radioactive iodine, which will destroy your thyroid tissue. So, if you leave one lobe in, that treatment's out off the books. You can't do that. And a lot of times what they'll do is if they're worried, say you had it in a lymph node or something, then the radioactive iodine will go in and get any thyroid tissue that's anywhere and destroy it. I'm not a big fan of radioactive thyroid. Just don't like radiation as much as the next person. But if I had spread, if I was worried about, spread, I definitely have my whole thyroid gland taken out and then do it if they found some stuff that was distal. When you take the whole thyroid out too, you need to have a good surgeon because, you've got your parathyroid glands there that you have to worry about not taking out or destroying. I'm sure a surgeon that's well trained on thyroidectomies knows how to do this. The other thing, you could have nerve injury to something called a recurrent laryngeal nerve on either side that could leave you with permanent hoarseness. Again, that's rare though. So, get a good experienced surgeon and, go from there. But certainly I would get surgery. I would get it out. But again, you can, my gut feeling is I'd get my whole thyroid gland out if it was me. But because the thyroid can be easily replaced, you wouldn't have to worry about it so much. You wouldn't have to get the yearly scans and all. But
let me get some follow-up questions in here that came in through email, just to see. I'm sure you touched on a few of these. This next one is, do you think it's possible it won't give out and I can maintain thyroid function with my thyroid globulin levels where they are now around 16? So I'm guessing if
yeah, if you have Hashimoto's, you follow the the thyroid globulin TPO antibodies, and it sounds like you're well controlled. But yeah, possibly, yeah, probably. Like I said, the Hashimoto's is kind of a minor player here. It's a minor factor in your thyroid cancer decisions. So don't let that Hashimoto's be a determination of, how you treat your cancer, in my opinion.
All right. So it kind of goes into this follow-up. If it is likely my thyroid will give out and I would need medication, would it be best to have the full thyroid removed? I'm hearing that's what you're saying.
That's what I would do personally. But again,
Yeah.
it's get with a good surgeon. Yeah. It's not that there's not rare complications from your parathyroid and your recurrent laryngeal nerve, but an experienced surgeon does these pretty routinely.
And the next questions, sorry guys if I'm jumping all the way around here. is around weight gain with thyroid. I'm thinking about how weight gain can happen so easily when the thyroid levels are off. My mom had thyroid cancer and had her whole thyroid removed. She's 150 plus pounds overweight and has had such a hard time with weight management since then. This could be due to other factors, but I do know she had no struggle with the weight until all of her thyroid problems arose. Any thoughts around this?
Yeah, I mean, in the hands of a competent doctor who knows a lot about metabolic syndrome and treating thyroid, that shouldn't be a problem.
Mm.
You know, it is true that a lot of people that have their thyroid moved gain probably 5% of their weight. You know, and that's, if you manage it right, you should be even. Plus, you know, nowadays we have a lot better tools to manage weight. You know, we look at insulin resistance, we look at a lot of different things than we used to. We've got a lot of good tools now for weight, so I wouldn't let that be a factor too much. That should not be a problem.
Mm. All right, and lastly, around the question with the thyroid cancer, if I leave the right lobe, is it possible cancer could develop over time? How often do you think I would need to do ultrasounds to keep an eye on it, on that right lobe if it's not removed?
At least yearly.
Mm.
Yeah, you would have to follow that. You know, like I say, it's a minimal risk. It's a definite risk factor, though. If you have cancer in one part, that it could be in the other part.
Mm.
I mean, a lot of people choose to get the whole thyroid out and then follow it up, clean any remaining thyroid tissue up with radioactive iodine. I don't particularly like that treatment unless I was pretty suspicious that it had spread.
Mm.
I've seen a couple of cases where it did and they didn't know it, but so that's kind of how I would approach it. But again, there's going to be a lot of opinions on this, and different opinions. Like if you went to an endocrinologist, they just probably try to treat it with radioactive iodine. Maybe, you know, they like it more so, but it's not without its complications either. So I hope that helps you out, and good luck with it. You know, you'll do fine.
Yeah.
You'll do fine.
In regards to this, any other recommendations? Any extra, more general thoughts as far as like maintaining thyroid function, etc.?
Yeah, you'll have to really closely follow, no matter what you do,
Okay.
your thyroid function test, and
All
still
right.
do all the other stuff we normally do.
All right, a lot there. I hope that helps. Like Doc said, we're going to be thinking about you. Keep us posted. From what I'm hearing, Doc, super positive stuff as well.
Yeah, you'll do fine. You'll do fine.
Thank you so much for sending that in over email, and hit me back if that helped or not. Okay, we're going to go to the live portion of the show. I see Ron Sandy over there on Instagram. I got you. Natalie, what's up? I see you. Thank you so much. Thank you. Let's see where we're at. Katie Lynn over from our Bristol office is in the building. What's going on? I love you so much. Thank you for being here. Let's see here. All right, let's rock and roll. If you guys got questions for Dr. Rogers, go ahead and put them in the comments. And we're going to start with Rhonda here. Over on YouTube, me and my husband are both taking the pain pills to cut down on costs. Could we take one pain pill a day or maybe 2 every other day and still get enough? I'm assuming this is the pain formula.
Yeah, you could. You know, sometimes I just take one. But they're meant to be. They're not like when you have a headache, take one of these. It's more of a chronic medication. But I mean, these things are loaded. That's why they're not real cheap, but they do work really well. I've had a great experience with them, but yeah, you certainly can just titrate it to your pain. And I always tell people take the minimal dose they can that helps them. Do all the other stuff you need to be doing as well.
All right, I hope that helps. Rhonda, thank you so much for being here. As always, let's keep moving. Looking for a question here. Thank you, Edna, for the update. Let's go to my brother Steve here. How does prednisone help with sudden onset back spasm. Will it work the same with a shoulder? Any thoughts on this?
Yeah, prednisone works about everything short term, but it doesn't really help spasm as much as it does inflammation. And a lot of times they come hand in hand. And what you need for spasms is a muscle relaxer, whether it be localized through creams or oral medication. But a lot of times with acute back flares, we pop somebody on prednisone for a few days as well as muscle relaxers and all the other stuff we have to use sometimes. Because back pain, I know because my back's bad. You have to hit it hard because it is debilitating, and it can be acutely debilitating to where somebody has to get you out of the floor. It's that bad, and it's usually the spasm that really causes, I think, a lot of that pain. And it's when you've had it, you'll know it. But yeah, the point with prednisone is just use as short a term with as you can. It's very helpful for most back problems. Same thing with shoulders. Shoulders are usually impingement syndrome. It's usually inflammatory in nature, and muscle relaxers don't help shoulders much, but prednisone sure will. Matter of fact, I need to do a podcast with Jill on the appropriate times to use cortisone injections.
It's a big question. I'm going to write that down. Cortisone. Out of curiosity, Pop, do you have, like we talk a lot about, I'm very interested in your medical kit in particular. Do you have something in the house that, say you do get a back spasm, is there something like a go-to that you?
Yeah, I do. I keep a muscle relaxer. I keep a Medrol dose pack.
Medrol. Okay.
Yeah.
All right, Steve. I hope that helps, brother. Thank you so much for being here. Let's get to Patricia over in Michigan. I just purchased a B1 supplement, hoping it will help me with falling asleep. Is it best to take before bed, or should I take it during the day? Any other suggestion for mind racing at night? I feel you, Patricia. That's tough.
Yeah. I don't know that B1 is going to help you fall asleep. Really, I think of the B vitamins as energy vitamins. So I prefer you take them in the morning, and that's one you could take on an empty stomach. But if I had racing, minds, I'd take L-theanine. That's one I really like for what I call mind chatter. I prefer that rather than B1 at night. Sometimes I use ashwagandha, saffron. I put all three of them in that stress formula that I have. But look at that instead of, if it works for you, fine. I don't know. I've just never put anybody on B1 to help them sleep. I don't know that it works for that.
All right, Patricia, I hope that helps a little bit. I see Carter saying the stress relief at night works for her. Carter's a big fan of the saffron in that, I believe. Thank you, Carter, for that comment there. Let's get to Roel over on YouTube. Doctor, I've been on TRT for 5 months, and on the blood panel, my red blood cell count, hemoglobin, and hematocrit triglycerides have gone up. I was told to stop till I see my doctor. Should I be worried? Some numbers for you. Triglycerides 174, RBC 5.98, hemoglobin 19, and hematocrit was 56.7.
Yeah, I'm not worried about the triglycerides. The tea had nothing to do with that, but certainly the tea popped your hematocrit up. So yeah, you need to donate blood. And probably 5 to 10% of people on testosterone, they have to donate blood occasionally. It's not real common, but it's common enough to where we have plenty of people that have to donate. So yeah, donate. Again, there's never been a blood clot documented for something like that, but thick blood will make you feel kind of tired. And a lot of times, if you ever see anybody that's really taking too much anabolic steroids, they have a red face if you go to the gym. And there's a couple pointers. If you see anybody in the gym that's just jacked up, they're bald and have a red face, they're taking too many anabolic steroids. You can just count it as given. But yeah, you just need to donate regularly. Now, sometimes the other thing you need to check is your estradiol level. A lot of doctors don't know to do that, but you could also aromatize your testosterone estradiol, and you need to block that down a little bit if it gets too high with zinc, DIM. Sometimes we have to use anastrozole, but certainly just donate. That's what you have to do. Sometimes if you're on testosterone cypionate, I'll even switch it to a nanthate. It's less likely to bump your crit up like that. So, there's people have to know what they're doing when they do the hormones. But certainly, yes, donate. That's your answer. Donate blood.
Roel, I hope that helps, brother. Tom's saying, see those red faces all the time at meets. I bet. Tom's a power lifter. So I'm sure he sees those red faces.
I don't have any hair either, do they?
Okay, let's keep going here. Okay, Steve, this is a follow-up. So it's with the shoulder. Will that work as well? So you're saying the prednisone would still work for the shoulder?
Mm-hmm. Yeah. Just don't want to use it long term. And if it's, that pinpointed like a shoulder, I'd prefer you get an injection in the shoulder rather than systemic steroids. It works better, and it's less likely to bump your sugar levels up and cause fluid retention. So, yeah, I would probably get it injected.
All right, let's keep going to Belinda over on Facebook. I was in Max today and asked if they carry Berberine that you recommended to take instead of metformin. I take 1,000 milligrams daily. My blood sugar usually doesn't run more than 160. I average 140. What they were saying is I would have to be really careful taking Berberine. Usually people who run really high around 300. I was also using Trulicity, but now in the donut hole, which is so expensive, I gotcha, to get now. The donut hole's something we need to talk more about too. That's such an interesting insurance thing. Do you think I would be okay to stop metformin and use Berberine instead?
I think Berberine is really about as potent as metformin with way less side effects. So I do like Berberine. Sometimes I use both of them. You got to be careful that you don't drop too low though. So, and remember when you use Berberine, use the dihydroberberine. It's about 4 times more effective than berberine hydrochloride, which is what you see in most stores. So get our berberine is the dihydroberberine, but certainly you need something to get those sugars down a little bit. Always eat a low carb diet, of course. Yeah, a lot of, treating diabetes, there's a lot of tacks to take, a lot of things you need to go to somebody. Hope your doctor is really well versed in not only nutrition but also supplements and medication. Unfortunately, that donut hole can be bad, and some of that medicine is ridiculously high.
Yep.
Yeah, but especially if you can't take Trulicity. So I would. If your sugars are average 140, that's not too bad. Hopefully, get a continuous glucose monitor. Hopefully, you're already doing that, and you get a better idea about how your diet affects your sugars. But certainly, I put a lot of people on Berberine. I'm able to get them off metformin. Most of them just can't tolerate metformin, don't like it because of the GI side effects. But yeah, you can certainly try that. And you're not in any danger because, you could even, what I would probably do is wean off the metformin, like take just 500 of it and just go ahead and add 1 Berberine, and then see how you do, and then balance it out, taper on off the metformin and go to 2 Berberine. I think that'd be a good strategy, just all the time watching your glucose levels.
Belinda, let us know in the comments if that helps any. Because I know the weaning off metformin can be confusing, and so let us know if that helps in the comments. I'll kind of be on the lookout for it. Amber, I see you. It's so good to see you. Amber did such a great job today in the North Knoxville office. It was so good to see you. Okay, let's keep moving. Let's see, Jasmine, what's going on? My sister-in-law is here asking about best care for uterus fibroids. any suggestions for Jasmine's sister-in-law?
A lot of it depends on the age, and I'd really look at the hormone levels, because sometimes if people get estrogen dominant, and that's what promotes uterine fibroids, which is just hyperplasia of the uterine lining, and you get into these little benign tumors that can bleed and cause pain and all this stuff. It's one of the most common indications for a hysterectomy. But I would look at the levels of estrogen and balance them out with progesterone. When you give natural progesterone, I do not recommend medroxyprogesterone. When you give natural progesterone, it definitely lowers your estrogen level. So she's probably estrogen dominant and needs that estrogen level to come down. The other thing I like for that's DIM, DIM. It's a supplement. But it just depends on how severe it is and what age. In general, as you get older, they start to shrink anyways. Your hormones go away. But I mean, they have uterine ablations where, they go in there and cut the blood supply off that feeds them. She's 41. Yeah. So she's, getting in her 40s. So I don't know how long she suffered from them, but they can be miserable.
Yeah.
I mean, I frankly have told people to, if nothing else works, just go ahead and get your uterus out. And if you don't plan on having kids in your 40s, please get your ovaries out too. Even though they have some life in them, that usually about a year after you get a hysterectomy, your ovaries are going to quit working very well anyway. And when you get them out, you don't risk ovarian cancer. And another just pearl while we're talking about this subject, if you are getting a tubal ligation for birth control, get your tubes taken out, not just tied off. The tubes taken out. They leave the ovaries, which still function, but if you do that, it's a very great preventive measure for prevention of ovarian cancer. They're starting to realize that, and it's kind of getting more routine. But so I asked the doctor about that. If you're getting a tubal, I think, how about taking my tubes out, not just, tying them off and cauterize them, get the whole tube out. So I hope that helps. There's a lot of different variances of uterine fibroids where they can really be a pain and cause all kinds of problems. So hopefully you've got a good gyno that can kind of help steer you that way. But check the hormone levels.
Jasmine, let us know if that helps your sister-in-law. Hopefully that helped it a little bit. Thank you for putting that question in for her. I want to go to Wayne because I know I missed Wayne and I'm looking for him. There we go. Wayne's question is, any recommendations for low white blood cell count? Which I hope, is that what WC means? I'm assuming.
Yeah, white blood cell. Yeah.
There we go.
Yeah, which is a function of immunity. But, a lot of people just run a 3 all the time. I don't worry about it if they're a 3. I mean, if they're, really below a 2 all the time, you need to see a hematologist to find out why. But I have a lot of people that are just, borderline below normal, but they're fine, never any problem. I just follow the levels and hopefully their immune system is good. I always recommend the vitamins for immunity, to keep your immune system up. That starts with your gut. Take Digest Shield, of course. But yeah, it's probably not a big deal unless it's really low and you get sick all the time. If that's the case, you need to see a hematologist. But if you do tend to, I just haven't correlated a borderline WBC with a lot of illness problems. I've seen it many times. I just never have correlated, seen a real relation to, hey, I get sick all the time because my white count's low. So I tend not to worry as much. But if it's real low or suddenly drops, then you need to see a hematologist. See what's going on.
Wayne, I hope that helps. Let us know in the comments if that was helpful. I'm going to go over to Instagram real quick. I see Gratitude Grace is in here. Nurse Courtney, what's going on? I want to get to Ron's question here. I can't put it up on the screen, guys, so I'm just going to read it out loud for you, Doc. I've had some hair thinning since increasing my tea cream to 2 milligrams per day. I've read free T levels are important, and SHBG and albumin levels. My last T level was 42. I hope I'm reading that right, Ron. Doc, you're getting anything from that? Sex hormone binding globulin is
Yeah, I mean,
SHBH?
yeah, but really the main issue, if you're losing hair with testosterone replacement, you need to check a DHT level, which is dihydrotestosterone. That's the part that can be responsible for hair loss and also enlargement of prostate. So sometimes if you're aromatizing, or if you're not aromatizing estrogen, also check your estrogen levels. But if you're converting more to DHT, sometimes I'll block that down a little bit. That's one reason a lot of guys prescribed it twice a day, just a really low dose finasteride to block that down because they're losing hair. So you want to get the benefits of testosterone, but you don't want to lose your hair. Why do you think all those powerlifters are all bald? But DHT is a more potent form of testosterone than just free testosterone. But certainly always check that if you do a complete hormone panel, you're going to get an SHBG, you're going to get certainly a free and total testosterone, estradiol level, and a DHT level for you losing hair. Have them check a DHT level. There's a way to reverse that. Sometimes they even switch to testosterone and enanthate too, if you have an acne or hair loss or things you don't like about testosterone. So, and you can run it too. I mean, maybe getting your T level too high.
All right, Ron, I hope that helps. I hope you're still with us over there on Instagram. I see Shauna's in here. Shauna, great to see you. All right, let's go over. I see, yes, Lisa, I got you. I'm going to go to you right now. See if I can find it. Lisa, thank you for sharing the show. Dr. Rogers, what is lactoferrin? QL, so far I've been diagnosed with this. I hope I'm reading that right. Lisa, the other tests are still pending. I have no clue what this is. Any clue here, Pop?
Yeah, I'm not sure what the QL, I'm not sure what condition you're talking about there. I'll have to do a little research on that, and we'll get back with you next week on that. I'm afraid to, give you any advice on that unless I'm really well versed on it. So Ben, write that down, and Lisa, we'll look at that next week for sure.
Lisa,
Ben, don't let me forget that.
I'm writing down lactoferrin and QL there for you, Lisa, and we'll get this next week. Thank you, Pop. Thank you, Lisa. It's in the bowel. Okay. I'm just gonna make a little note here. We'll do a little more research, Lisa, and we'll get to that.
It's an absorption problem, I think, but let me study up on that a little bit before I attempt to give you a good answer.
All right, Lisa, thank you so much. I'm going to get to Max on YouTube. I know I'm bouncing around a little bit, guys. Forgive me. I got my CT scan and ultrasound results and showed that my bowels are inflamed. It even causes me frequent burning, urinating. What do you recommend for immediate relief, and who is the gut expert in one of your offices? Okay. Let's see if am I reading that right, Max? I hope I am. You getting enough? Do you need more context, Doc?
So you had a CAT scan and an ultrasound of your abdomen, upper abdomen usually, and showed bowels are inflamed. I don't know if you have diverticulitis. It's hard to see an inflamed bowel through those tests. And I don't know how that relates to burning on urination. Although you could have just an overall inflammatory, hyperinflammatory response. You definitely need to get a colonoscopy if you think your bowels are inflamed to rule out inflammatory bowel disease. Saw one of those yesterday. But our gut experts, Robin Riddle, in our offices, immediate relief, it sounds like to me you're having two problems. You're burning on urination, which you need a urine check. Sounds like you need to come in and let us help sort this out. Poke on your belly, check your urinalysis, see what your inflammatory markers are, your CBC, because you may need some antibiotics. I mean, I would say take anti-inflammatories, but you in fact may need antibiotics. I mean, if you have an inflammatory diverticulitis or a pathogenic bacteria in your colon, then you may need some antibiotics for it. So there's going to be no quick fix to tell you to go take something tonight. I always like curcumin. I mean, you can take a pretty good dose of it. If you have some at the house, but you really need to probably come in and let us check some things on your review, exactly what those scans looked like. And I don't know if you've had a colonoscopy recently or not, but that sounds like what you need. So I don't know if anything's going to give you instant relief, but I tell people if they're having gut problems, stop eating, rest your gut, clear liquids, and maybe clear because just come into one of the offices tomorrow and let us try to sort it out for you. I'm glad you came on here and asked me that, because that's something that needs to be looked at. I don't
Max,
know if you're running fever, if your white count's high. That could be something that's maybe a little bit more challenging to answer right here on the, without looking at you and all your stuff.
Max, let us know if I read that wrong. And Doc is right. Robin Riddles in our Knoxville office is our gut expert. She's in the
It's
West.
possible you may have prostatitis as well. Again, the fastest thing to calm everything down was a short burst of steroids. But again, if you give steroids with an infection going on, it could possibly make it worse. It'd be rare, but it could. So that's a hands-on thing, Max, I think.
Max, thank you for putting that question in. I hope that helps a little bit. Okay, let's keep going here. I think let's get to Mike here. Mike, what's going on, man? It's so good to see you. After finding mold in my house, I've tested positive for mold in my body. Robin gave me cholecystolum. Definitely mispronouncing that, Mike.
Probably cholestyramine, probably.
Cholestyramine, as well as I'm taking activated charcoal. Any other ideas for Mike here?
Yeah, there is a nasal spray that I used to be able to order called VIP spray, vasoactive intestinal peptide. I'm not sure if it's still available. That's one that you may want to consider. If we can order that peptide, I've done it a few times and it's helped. It's pretty good for mold. Of course, you're out of the house. Hopefully, you're out of the moldy environment. I don't know how your gut's acting, but I love the activated charcoal. I love drinking a lot of water. The other thing I would do is get an infrared sauna. Anything you can do to detox yourself from that mold. And usually, once you're out of that environment, if you do those, like a gut detox, sweat detox, water detox, then you can probably clear up pretty good. A lot of times it'll just activate this hyperimmune response. Sometimes I even use low dose naltrexone for that as well. So those are some things you might want to think about doing, Mike.
Mike, I hope that helps a little bit. I saw this. I saw this come up. I couldn't help but smile from my man Mark here. I have a friend who has developed an aversion to getting his hair cut. He's a very nice guy, but he's starting to look like a homeless person. Should I be concerned? My answer to this would be yes.
Probably.
Yes, most likely.
I saw Ben downtown in Market Square in Knoxville last week, we were going to meet up, and I was walking around some of the shops, and I saw Ben come up. I didn't recognize him, so I was about to give him some change or something, but then I realized it was my son Ben. So things can be deceptive.
Thank you, Mark. I love it. I see. That's right. Tom's hair is thin, but he has not lost it. I hear you, Tom. I love it.
Yeah.
Okay.
You got it, Vomit.
I think we are. I think we are through the questions here. If I missed somebody, let me know. Let's see if I missed anybody. And we could be calling it a show. We appreciate you guys so much. I see you, Nora, on Instagram. Tina, what's up? Let's see here. All right, I think we are through the questions. All right, how'd we do, guys? How'd we do? Give us a 1 to 10, and if it's a 1, I get it. We did our best.
Can you give us a quote of the day, and maybe that will end things pretty good.
Let me
give me a quote of the day.
Let me think here on this quote. And while I think, let's get to Mike's. Mike wanted a little follow up with the spray.
The VIP. It's called VIP spray, and it's got to come from a compounding pharmacy.
All right, Mike, I hope that helps. I see we're getting a bunch of 10s. Amber's giving us a 12. Lisa gave us a 20 plus. You guys are the best. You guys are the best. Thank you, Carter. Thank you, Katie. Thank you, Mike. Thank you, Cherry. I love you. Quote of the day would be, let's see here. I want to leave us with something that we can all take with us. Thank you, Stan. Thank you, Rachel. Quote of the day. You put me on the spot, man.
I know this is a hard one to come up with a quote of the day. I'd have a hard time doing it, but I thought you maybe could come up with something.
I know I can. Roel, do you like the one with Marcos? The podcast with Marcos Gaza? That was a fascinating conversation. I was actually there when they recorded. I thought that was super cool.
I'm doing another one with him next week on patient rights. It'll be very interesting.
Yeah. Thank you, Danny. The patient rights one is super interesting. One, if you guys have questions about patient rights, it's important. Put them in the comments. When you go into a hospital or when you go into a doctor's office, a lot of times I think patients go into the doctor's office and just kind of, do what they're told, and that's not necessarily a bad thing. But Marcos went over a bunch of things that you can be intentional about. Thank you. Yep, that's right. All right. A quote of the day. I want to leave you guys with this, and that is, hold on. Carter's inspiring me. Carter knows I can do this. An encouragement quote. You know what? I'm gonna go super encouraging. I'm gonna go. Yeah, I might go. This might be too deep, but guys, I'm gonna leave you with a quote here, and it is, "Love thy neighbor."
Man, I love it, man. That's a good quote. That's a good.
That
says it all. That says it all.
That's simple. Let's leave this week. Love thy neighbor. I love that. Thank you, Jasmine.
Very good quote. I love it. If
guys,
we could all do that, the world would be an easy place to live in.
Yes.
That's all they'd have to follow.
Thank you, Sandy.
That one thing.
Yeah, in that, it's so funny. It's like, we're, obviously it's, there's so many divisive things, and but if we can kind of focus on that, I feel like, one, the world will be better, and us individually be better. So love thy neighbor, guys. I love you guys. Thank y'all for being with us. Pop, I love you, man. I love you like a father.
Thank you, man.
All right, guys, we are out of here. Y'all are the best. Mark, I love you. Dave, thank you so much. We'll be back next week, 7 to 8, Tuesday, doing live Q&A every single Tuesday. Thank you to all of our team. I see so many of you in the comments. You guys are the best. Y'all did such an amazing job today. Thank you to anyone who has ever shown up on the show, been to one of our offices. We appreciate you. We love you so much. We'll be back next week. All right, Pop. That's my
Okay.
outro.
All right. Good night. Thanks for the
Thank you.
quote. Very good.
See you guys.
Don't go away.